So men are comfortable being like room and parlor. They don't care. I started loving my father the more when I started paying my bills. My name is Ebube. I'm a community pharmacist and also a health content creator. Today is Father's Day. We're celebrating the fathers by just giving a little health talk. But first of all, I just want to use 1 minute to say, I'll be frank with you. I did not understand him very well till I started, that I became, I'm not a father yet, till I started doing life on my own. Once more, I say Happy Father's Day. We want to talk about prostate cancer. Some people say prostrate. Rarao. It's prostate. What exactly is prostate cancer? I want to say prostate cancer, what men should know. Young guys say, if you know they change oil, you go get prostate cancer. I don't understand. That's a very big lie. It does not have any connection with prostate cancer. When we talk about prostate is just an organ, or rather a gland, that is found only in men. It is not in women. This is the only problem that men inherited that women does not have. It's actually sitting. Hallelujah. So, when we talk about prostate as a gland, it's just after the bladder. We already know what bladder is. Abi? After the bladder, just beneath the bladder, you have the prostate gland. It sits right at the pipe where urine comes out from. That is why whenever it is inflamed or infected or something happens to it, it becomes a problem. Now, what exactly causes prostate cancer? It is not I don't know how to say it now. It is not, if there's a word like non-frequent or infrequent ejaculation. That's not what causes prostate cancer. Number one, as an African man, just know that you're already at 50% to having prostate issues. Yes. As a black man. That's number one. Then number two is when maybe your generation is hereditary. For example, your grandfather, your father had prostate issues. If you are above 45, please go and do your PSA, meaning protein-specific antigen. What does it do? It calculates the amount of that free protein produced by the prostate in your blood. I'm saying so much medical terms. I don't know how to break it, but okay, sir. So, if you're above 45 years and you have done the screening, please, can I see your hand? Is it only the pastors? Okay, only pastors, they are above 45. Please, if you have not done the screening, it is very, very essential that you do it. So that you know, we're not saying you have it. So that you know your stand. You know where you belong. Now, when there is poor urine flow, that means the prostate is inflamed or infected. Especially when you wake up at night, every time you are waking up at night to urinate, every day you are waking up at night frequently to urinate, that's one major sign of prostate issues. There is prostate enlargement, there is prostate cancer. If there is prostate enlargement, it does not mean the individual is down with prostate cancer. Enlargement meaning that the gland is increased in size. Cancer meaning that it is increased in size and there are abnormal cells growing around. And cancer can be bad because it can spread. But enlargement cannot spread. So if peradventure the prostate issue is detected earlier enough, it can be treated to avoid cancer. I don't know if you are following. But if it is not detected early, that is where the issue is. Now, people say, what exactly causes prostate cancer? If you have asked yourself that question, just the cause till today, when me and you talk, They never still find them. Yes. Sometimes they say it is idiopathic, meaning that we don't really know the cause. But there are risk factors to it. What do I mean by risk factors? Things that you do or things that are in place that may linger and cause that issue. Number one is obesity. Obesity. Some men are so in women that they tell them, your stomach is big. You are not getting in shape. You can go and do exercise. But them themselves, they don't know, say, their BMI. Some men are comfortable being like room and parlor. They don't care. They don't care. Once that, and especially Igbo men, without their big stomach, they don't care. Nkwobi in the morning, whatever they care, whatever they eat in the afternoon, it's not their business. Once your adipose tissue, that's the fat gland, is increased, it can bring down some hormone in the body. And number one hormone is testosterone. That is the male hormone. If you are a man and you are not having testosterone in a normal level, you be CC. Are you getting my point? Yeah. Now, if as you are expanding laterally without having any horizontal growth, like people like us when we say we know too tall, not be say we know tall, but we know too tall. I am sure, don't worry, I'm sure. If your BMI, body mass index, is above 27 and you are above 40, 45 years, that can be a factor. What do I mean by BMI? BMI is the measure of your height and your body weight. I had a patient at 35. I checked his blood pressure. It was 201. Yes, over 141. And I asked him a simple question. Do you smoke? I say, why now? Na man I be, why I no go smoke? I want to understand that picture. That as a man, I suppose drink, I suppose smoke. Me, I no understand that. But if that is your own ideology and analogy, ride on, sir. We go sell drug as pharmacists. We go sell supplement. So if you don't want to listen, you will pay in cash to listen. It's a simple truth. My father, anytime he checks his blood glucose and is over 100 fasting blood sugar, up on him na phone. Ebube, sugar is high. I said, Daddy is not high. That is just 100. And he eats just once a day. He's above 70, but if you see him, you will not know. Once a day. But back to what I'm saying. As a man, he say, in gas smoke, in gas drink. But before I even come to smoking, let me talk about drinking. Drinking has a way, alcohol, there is no safe limit. I don't know if you remember, as I said it last time. What does it do? It can cause a decrease in some hormones in your body. And when that hormone is decreased, that is why people who have hangover or people who take alcohol, they urinate frequently. Because they call it antidiuretic hormone. That hormone is suppressed by alcohol. So when you frequently disturb your bladder, it can weaken. And when your bladder weakens, it's going to the prostate. I don't know if I'm making sense. Now, if as a guy, you don't work out, you don't do exercise, you don't do anything, and you don't even know where you stand, is a big factor. Now, I will close with this. Now back to PSA. If you have not done your PSA, it is vital and important you do it when you are above 40 and 45. And if the PSA is high, they have a way and medication to bring it down so that in future it will not cause any issue. Hallelujah. Hallelujah. Then as a man, always screen yourself. Check your blood pressure. Check your sugar level, especially when you know that in your lineage, there is sugar issue. Please do check so that everything and all the risk factor will not come down and cause prostate issue. Thank you for listening. I don't know if I made any sense. Thank you very much. So if you have any question,